Vitamin C, also known as ascorbic acid, is essential for maintaining the health of your skin, cartilage, teeth, bone, and blood vessels. It also helps protect your body's cells from damage, and is considered an important antioxidant. It is used to prevent or treat low levels of vitamin C in people who do not get enough of it from their diets. Low levels of vitamin C can lead to a condition called scurvy, which may cause symptoms such as rash, muscle weakness, joint pain, tiredness, or tooth loss. Most people who eat a normal diet do not need extra ascorbic acid, but for those who do, the daily recommended dose is 65 to 90 milligrams. It is best to take vitamin C with a meal to help with absorption. When taking C-1000, you can take it with or without food, usually 1 to 2 times daily. Follow the directions on the product package or as directed by your doctor. For extended-release capsules, swallow them whole with a full glass of water. Do not crush or chew them to avoid side effects. If you're taking wafers, chewable tablets, or lozenges, follow the specific instructions for each. And if you're using the powder form, mix it thoroughly with the proper amount of liquid or soft food, and take it right away. Don't prepare a supply for future use. The dosage of C-1000 is based on your medical condition and response to treatment. It's important to take it regularly at the same time each day to get the most benefit from it. If you think you may have a serious medical problem, seek medical help right away. If you experience diarrhea, nausea, vomiting, abdominal cramps/pain, or heartburn, consult your doctor. If your doctor has prescribed C-1000 to you, they have determined that the benefits outweigh the potential side effects. Most people do not experience serious side effects when using this medication. However, if you notice painful or pink/bloody urine, or signs of a serious allergic reaction such as rash, swelling, severe dizziness, or trouble breathing, seek medical help immediately. Be aware that this is not a complete list of potential side effects, so consult your doctor or pharmacist if you notice any other effects. It is recommended to take C-1000 as directed by your doctor and report any side effects to the appropriate medical authorities in your country. Before taking C-1000, it's important to talk to your doctor or pharmacist if you have any allergies. This product may contain inactive ingredients that can cause allergic reactions. Also, make sure to inform your doctor or pharmacist about your medical history, especially if you have kidney disease or a certain enzyme deficiency. If you're planning to have surgery, it's important to let your doctor or dentist know about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. For pregnant women, C-1000 has been found to be safe when used in recommended doses. However, higher doses should only be used if clearly needed, so it's important to discuss the risks and benefits with your doctor. This vitamin is also considered safe during breastfeeding when used in recommended doses, but it's always best to consult with your doctor for more information. When taking C-1000, it's important to be aware of potential drug interactions that may affect how your medications work or increase your risk for serious side effects. It's important to keep a list of all the products you use and share it with your doctor and pharmacist. Additionally, be cautious with certain lab tests as C-1000 may interfere with them, potentially causing false test results. Make sure lab personnel and all your doctors are aware that you are taking this vitamin. If someone has taken too much C-1000 and is experiencing severe symptoms such as fainting or difficulty breathing, it's important to seek immediate medical help by calling 911 or a poison control center. In the U.S., residents can contact their local poison control center at 1-800-222-1222, and in Canada, residents can call a provincial poison control center. Remember to keep all your medical and lab appointments. C-1000 is not a replacement for a healthy diet, so it's important to get your vitamins from nutritious foods. Ascorbic acid, or vitamin C, is often found in citrus fruits like oranges, as well as in tomatoes, Brussels sprouts, cauliflower, and broccoli. If you want to know more about the benefits of C-1000, be sure to consult your doctor, pharmacist, or nutritionist for additional details. And always follow their advice on the best daily dosage and the optimal timing for taking this supplement. If you forget to take a dose of C-1000, take it as soon as you remember. If it's almost time for your next dose, just skip the missed one and take the next dose at your regular time. Don't take a double dose to make up for the missed one. When it comes to storing C-1000, it's important to note that different brands may have different storage requirements. Make sure to check the product package for specific instructions or ask your pharmacist for guidance. It's essential to keep all medications out of reach of children and pets. When it comes to discarding C-1000, it's important not to flush it down the toilet or pour it into a drain unless specifically instructed to do so. Instead, properly dispose of the product when it is expired or no longer needed. You can consult your pharmacist or local waste disposal company for the best way to do this. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.